Okay, students, today's topic is maternal and child health. Maternal and child health care is one of the main components of the PSCs. Because of this program is held by the PSC mostly for the maternals who are womanly conceived and who are intraoperative phase and also in the post-operative after the prenatal. Declared at the Alma Ata Conference in 1978. This act has been discovered in the 1988 at the Alma Ata Conference. Maternal and child health care service provided by the state government and NGOs together. Like these both are providing the same like treatments, like PHCs and NGOs are providing the same like treatments for the maternal and child health. Services are free of the charge because this is a government services. MCH services are the size of women's and children's preventive and curative services in the both aspect. This act is working like preventive before any occurrence of the disease and cure any after occurrence of the disease. This is a PSC component where there is be easily available, affordable, and accessible to all the populations for the community who are living in the community. These services are for all the communities people. First aim is to secure complete health care for all the children in the community, and second aim is all the women during their reproductive life. We have to think about the both the side. We have to secure our children also, we have to secure the women also who are in the reproductive child. It means who have adolescence periods and who has the menopause up to the first menstruations to the up to the menopause last menstruation cause a reproductive life. For that you have to maintain the aims for all the women and all the children who are living in our community. Components of MCH women health. First one is the antenatal care, like firstly regular examination, immunizations, proper nutrition, and self-care of that particular antenatal man who have conceived. Then provision of the cells and delivery sites. Provision of cells delivery sites we have to use the USG for getting the womb's size. Then postnatal follow-up after the delivery of the baby. There is only most important things is a postnatal deliveries because the woman having the local changes, woman having the physiological changes at the time of the postnatal period. So it is a follow-up, at least 2 follow-ups needed under this act. Family planning services and health education policy according to the family planning services and according to the health education counseling. Now we will see about the components of the MCH activities like woman health. Woman in the first components, then provision of safe delivery, postnatals, antenatals, family planning, birth spacings, and the health educations related to birth spacings and barrier methods. Also contraceptive methods or IUD insertions. Now, child health. Growth and development monitoring include proper nutrition as well as breastfeeding, immunizations of all the child, like breastfeeding initiations within the deliveries for 30 minutes, and immunizations for all the children from birth to at least 16 years. Parents for all newborns and the children with the high risk diseases like congenital deformities or health education to ensure healthy children, like health education according to their hand washing, sanitizations, and health education of the non-communicable and communicable disease. Early discovery of the congenital anomalies, if present, then we have to take the risk. Then we have to consider as a risk. Then we have to go further any other studies. Objective of the programs: provide optimal antenatal pregnancy woman care, then prevents little any deviations of the normal pattern of the pregnancies, like any changes in the normal pregnancies we have to detect by the USG or by the palpitations. In the identify that give special attentions to the pregnant woman at the risk, like special attentions like psychological need and physiological needs that is considered as special attentions. Then assertion outcome of the each registered pregnancy to survive the newborn. We have to go further. All the registers, bank records and pregnancy records and the infant records. To reduce maternal death, early detection and management risk of the complications for at the previous studies at the first trimesters, and so optimal standards of the provided high risk pregnancy care during the delivery of the extensive assisted deliveries we have to follow. Then towards the hospitalization score, then we have to maintain the costing of the hospitalizations by providing the standard of the care, prevent the adverse developments, then at least for MCH clinic early possible within the 42 hours, and the dates we have to go for the first visit of the postnatal care and the after within the 42 hours at the second postnatal care for maintaining the physiological changes, logias, and the other changes after the deliveries which we have seen in women. Another then to promote the patients by providing the early and to frequent care for close pregnancies, provisions of comprehensive family planning. We have to counseling to the that particular mother for maintaining the birth spacings, also reduce the chance of the any congenital memory to the second baby, and also getting the for the maintain of the HB level to that particular mother. Encourage women to share the responsibility of the whole health, like healthy lifestyles, physical controls, postnatal exercise, antenatal exercise, then weight controls, immunizations. We have to counsel that particular mother. Elements of the maternal health like antenatal care. Antenatal care considers of the from the conceivance to the delivery. The natal care is considered as a intraoperative phase where we have to safe delivery or assisted delivery in some cases, and postnatal care considers of the after 2 visit after the delivery of the baby. Family plannings and health educations consider on the best spacings and maintaining the IUD or intra-emergency pills or contraceptive pills, which these R5 are the elements of the maternal health. Family planning is also considered as some conservative failures and the counselings. Thank you everyone.